something that is really coming up in my office. It's much more popular than I've ever seen before. So I'd love to get an education from you about it. Is a lot of people are going to naturopaths and they're getting allergy tested. Tell me about that type of testing. Is that something that you offer in your office? And if not, why not?
So, I mean, usually what the naturopaths are offering are a battle of tests called IgG testing. I see it all the time in my office where patients will have gone for some kind of complaint and they want to go a more natural approach. So they'll see a naturopath and they're offered this barrage of IgG testing where a huge panel of foods is looked at by the IgG. And then they're told that they, have to avoid a whole list of foods because the IgG was positive to those foods. And it makes me very sad and frustrated when these patients come in because first I know that, none of these tests are covered by insurance. Because for good reason, they don't really get to the root of the problem. I tell my patients all the time, I wish there was a test that could tell me what you're intolerant to, because then I'd be offering it all the time. I want my patients to feel better. That's why I went into medicine. And I try to explain the immune system because I think that when you understand the immune system, you understand why this test isn't a valid or a test that should be given any weight to. So like we've gone to this whole analogy of our protection system and our security system of our body. The immune system is our military. So we have different arms of the military. We have, the Army, we have the Navy, we have Special Forces, and each of those forces has a different name. So we have, IgA, which is in the mucosal membranes. We have IgG, which is our, responder antibody after IgM, who's like the first response. And then we have IgE, which was responsible for parasitic infection and has now become the allergy antibody. So IgG is really just an antibody that our body makes when it's exposed to something. So, I'm sure everybody, especially after COVID, has looked at titers and they wanted to know if they were protected against the vaccine. And so we're looking at, the IgG levels to COVID. Basically, those are levels that are telling you that you've been exposed to something. It doesn't mean that you're intolerant of it. So if you have IgG to egg or if you have IgG to, asparagus, it doesn't mean that you can't tolerate it. It just means that you've had it in your diet. And usually the levels on an IgG test are highest to the things that you eat most regularly. And the problem is that these are now being interpreted as something that you cannot, have anymore, and ends up, costing a lot of money and then costing sanity because parents are doing these hugely restrictive diets for no reason.
So when these tests check for IgG, what are you checking for when you check for allergy tests?
So we're looking at the IgE. So IgE is the original antibody that our bodies use to fight parasitic infections. And since we don't have a lot of those anymore, I use that, the fact is they kind of got bored and said, what are we going to fight against? And then our immune systems went into overdrive, and that's what allergy has become. It's basically the body reacting to things inappropriately with IgE.
So this may sound like a silly question, but why don't the naturopath doctors measure IgE if that's what's been validated and that's what you're checking for? Why are we all not on the same page?
Because the naturopathic doctors are usually looking at intolerances, which is a very different thing than an allergy. If you are lactose intolerant and you come into my office, you will not come up to testing on milk. It's a different mechanism. So they want to offer their patients something. And if you test somebody who doesn't have allergies, then their IgE is going to be normal and they're going to have nothing to tell their patients.
I see. So IgE, just for clarification. Just for clarification, IgE is checking for an allergy, something that your body is responding in an allergic way. But IgG is a measure of tolerance, something. And if you're intolerant to something, your body may not react perfectly to it, but you're not having a true allergy. Am I explaining this correctly?
I don't think I would say IgG is a measure of tolerance because it doesn't really show whether you're tolerant or not. I think elimination of the food and seeing how you feel is probably the best way to do that. It just shows that you've been exposed.
So that's it. It just shows you've been exposed.
As simple as that. Yeah.
So this is so interesting because people will come to me and they'll say, I have a reaction in my body. My body made a lot of IgG to corn and bread and eggs, and I love all those foods. And they're feeling torn about whether or not to eliminate those foods from their diet. What would your advice be for those patients?
My next question to them is, so now that a lot of them have come cutting it all out. And if they have cut it all out, I say, how do you feel? Do you feel any different? And 99% of the time they say, no, I feel exactly the same. So I tell them reintroduce them one at a time and see if any of them cause any problems, or even reintroduce them all. But sometimes really the reason a patient is going to a naturopath is because they're having some sort of symptom. Their stomach is bothering them, they're bloating, their discomfort. They're having some problem that they're looking for answers, and they're looking for help. And what I tell patients is reintroduce the foods and see how you feel, because if you're feeling fine on them, that's the most important thing. And that's the problem with doing just IgE testing in everybody too, because you can get false positives with a lot of these tests. Funny enough, shrimp and dust mite look very similar to our bodies. So a lot of patients who have a dust mite allergy, it'll look like they come up positive to shrimp on testing, but they eat shrimp all the time. So what I usually tell patients is these tests that I do are really good to figure out what you suspect and to confirm something that you're suspecting, confirm a diagnosis. It's not necessarily the best way to just figure out what you're allergic to, because the most important thing in our practice is, can you eat it or can you tolerate it? So even if a patient, for example, can't tolerate dairy because they're lactose intolerant, the best way to figure that out is to eliminate it and see how you feel. And that goes for so many different foods, and there are lots of diets, and there are lots of suggestions of foods that you should eliminate just because they're harder to digest. And I think that that's a better approach for patients that come in. And I turn patients down a lot that come in for food testing because I know that my testing is not going to answer their question.
This makes so much sense to me, that the way to go about it is to see in real time how you respond and how you feel after eating a food, but let those tests maybe be your guide or point you in the right direction.
Yes.
I think that's really smart, because if you rely solely on the test, then it sounds like it'll be not only costly, but we'll have a lot of unnecessary dietary restrictions.
Yeah, and it's happening. So I hope you all pay attention.
No, thank you. Thanks. I think it's good for everybody to be educated and aware, because that way if you do go for that kind of testing, it's good to know what the information you're receiving is.